Hey, so a lot of people have been asking with a lot of knee pain questions, so that's what we're going to address. A lot of people have been asking, should I use heat or ice when my knee starts to hurt? Well, really the best thing is kind of dependent. If it's a brand new injury, like you just did something, ice is going to be better for like the first 48 hours. After that, if it's more just a ache at rest type of hurt, that often is more of an arthritis type of pain, especially if you haven't had like a specific, hey, I went down and I fell and something happened, or twisted and felt a pop. Those types of things are different, and those should be assessed differently. But if it's just a, hey, the weather's starting to change, I'm kind of feeling like my knees are aching, what's the best thing I can do? Heat is going to be your friend. Heat tends to help with arthritis pain. So that's one of the biggest characteristics of arthritis, is if your knee starts to ache at rest, especially if you haven't changed a lot of your routine. So a lot of people tend to ask me too, does weather truly affect it? Like, I feel like it does. Am I crazy? No, you're not crazy, not at all. I truly believe, I don't think there's a lot of research showing one way or another, but I truly believe those changes in the barometric pressure in the atmosphere truly do affect our joints. If you think about it, we have fluid in our joints. That fluid is called synovial joint fluid. And that kind of gives us the lubrication in our joint for us to bend and move without having a lot of like bone-on-bone friction. And by the way, exercise helps that fluid a lot more, and it's going to help you feel less achy. So even though you ache, movement is something that you want. It's going to help you. So movement is key. Try to keep moving. When you're resting and you just want a little bit of relief, heat is going to be your better choice. But the weather, it truly can play a role. I know there's no science, like research, I think, showing one way or another, and a lot of people dismiss that. But I truly believe it does play a role. So have a little faith in yourself. You're not crazy. It's honestly one of the most common things that we hear. So you're fine. Let's see what else I wanted to answer for you. I had several people kind of shoot me messages, so I wrote down questions of what I wanted to cover. Someone else was asking why going up and down stairs, especially going up the stairs while they're carrying something, like when they're carrying their laundry basket upstairs, why on earth does that hurt more? So if you've been wondering why it's hurting more, it really comes down to just science. And if you think about like the physics and the science behind, you're adding more of a load onto the joint. So all of a sudden it's stacking. If you think about like building blocks if you're a kid, the higher you stack and the more load that you put through something, the more forces that it has to bear and hold. Not that your joint can't handle that. Your joint is not weak. Most likely your bones are not weak, unless you've been diagnosed with osteoporosis, then maybe you have some weakness there. But your bones are strong, and you are strong. And that's a misconception that some people get. It's like, oh, but I have a weak knee. It's like, well, maybe the muscles around your knee aren't as strong as they could be, sure. And that's something you can work on if you choose to. But it really comes down to the forces on your knee. So what can you possibly do? We kind of just talked about it. What you can do if the forces in your knee are really starting to bother you as you carry that, whether it's a load of laundry up the stairs, if it's a grandchild up the stairs, you need something that's going to take some of that force. Well, what are your choices? Well, your choices are pretty much, if you think of your muscles and how they come off your bone, think of that kind of like a suspension bridge. So suspension bridge, you've got, let me see if I can get a quick little paper. I am not an artist, so do not make fun of me. My 6-year-old can draw much better than I can, I promise. So down here's your river, and then your suspension bridge, you've got like these pillars. Let me color this in a little more. I am so, like, if we would play like Pictionary, you don't want me on your team. I'm not good at this. Okay, so think, here's your little river, right? Here's your bridge. Here's your suspension, kind of your posts. So think of those like your bones, okay? Those are like your bones. And then see these here? Those are like the wires that connect down to the bridge, you know? Are you following me? I hope. I'm a science major, not an art major. Forgive me. But all those little wires like these, think of those. Like those are like your muscles attaching onto the bone, okay? So if you think of it like that, that is going to be basically your strength. So that's how you take some of the load, right? Like on a bridge, all of the weight of the cars can't be loaded just through these two things. Some of that load has to be distributed out. So that's what you're doing when you're strengthening. You're distributing that load so it's not so much down through your bones. So you have to figure out, how do I strengthen these muscles without hurting these, your bones and the joint itself? And a lot of that, it's not, you can do it a little bit trial and error by yourself. And sometimes that's okay and it works. But you also, it's kind of a science, and a little bit of a science and art form mixed together. That's my art side. Oh my goodness. Hey, my phone totally fell. I'm sorry, I'm back. Forgive me for that. Ooh, we're still shifting and moving. Let's get you set back. Okay, I think we're safe now. I must have bumped the table or something. Forgive me. So strengthening all of those muscles. So what muscles are those? Well, what attaches around your knees? Your quadriceps, front of your thigh, your hamstrings, the back of the thigh, and into your calf muscles. So gastrocnemius and soleus are your main calf muscles. Soleus doesn't come above the knee. It's going to affect how you move and how things are, but it's not really going to take off the load. The load is going to be that. And then further up into the hips too. But those are going to be your key ones, quadriceps and hamstrings. If you can really work on strengthening those, that's going to take some of this load bear for you, and that's going to help you. But how you do it while you have knee pain, that's kind of the expert part of it. You can try it on your own, feel free. But if you need guidance, it's really person specific. Like I can't just be like, oh, this one thing, this is going to work for like 1,000 people. No, our bodies are made different. You're different. You're not the same as your husband and your sister and your best friend. Your body is different. It's unique. It's tailored to you. We all are shaped differently. Our bones are different. And your muscles are going to work different. And what you do day to day is nobody else lives the same exact day as you. No one else has the same requirements during their day and same things they're doing. So that's why a custom plan is going to be what you need if you're not able to get it on your own. But give it a try first. I want you to get out there, strengthen, move, see if you can get that help. Take some of that load off of that. My biggest mission for the next year that I have set for myself. So there is a huge opioid epidemic in our country. I'm sure you've heard of it. I'm sure you've heard of the overdoses and how much doctors now have to be really strict and stringent on how they are prescribing. And I want you to know that you don't need strong medicine. You don't even necessarily need Advil and all the over-the-counter stuff or injections. Movement is medicine. That's key. So movement is truly medicine. If you move, your body can heal itself. And your bones even, the cells regenerate themselves. And same thing when you strengthen. The fibers of the muscle, they're rebuilding. And when they build again, they build stronger. Isn't that awesome? Like, to me, that's just amazing. It truly is. And that's why, like, I love this stuff. Like, this stuff is so cool. I kind of geek out a bit on the nerd science part of it. But it's so fun. And you can totally do this. And you can do it without injections. You can do it without medicine. You can do it really any way that you want. And it doesn't mean just because you have knee pain that you're going to have a knee, like, joint replacement. It doesn't have to be you. I read a crazy stat the other day, by the way, to share this real quick. And that was that it was like for the age 45 or like around 46, the amount of people getting joint replacements has increased by 130%. Wow, 130%? Like, my goodness. I know that surgery itself and the materials they're using are lasting longer and doing better. But if you don't have to have someone go in and cut your bone and hammer in brand new like knee parts, I don't know. I don't want that. I'm someone that I want to heal wholly with my own body and have it heal as much as I can on its own with the least amount of help as far as like putting stuff in my body or doing stuff to it. That's why I am just naturally drawn to exercise and fitness and nutrition and what can I kind of do to heal myself. And that's what I want to share with you. So if this was helpful, do me a favor, share this with a friend that you might think benefit from it too. Because I know there's somebody out there that you probably know that has knee pain that might get something out of this. So if you did, please share it. And I will talk to you later. By the way, I don't think I ever introduced myself. I am Dr. Shari, orthopedic physical therapist with Athletity, and I am happy to help guide you and help you along with this whole process. So have a great one.